Hi Banu, so today I'm going to be measuring your gum depths using a millimeter measurement tool. 1 to 3 millimeter, as you can see here, from this to the black spot right here is normal. Above 3 millimeter indicates periodontal infection. Now if you have an above 3 millimeter depth, then that you would need a more advanced cleaning than regular cleaning. And basically periodontal infection is a type of disease that affects the gums, the tissue fibers, and the bone. If it only affects the gums, it's called gingivitis, and if it affects the bone and the tissue fibers, then it's called periodontitis. Now, while measuring your gum depths, I'm also going to be looking for any signs of bleeding. A healthy tissue bleeds. A healthy tissue never bleeds. Diseased tissue bleeds. And additionally, I'll be looking for any receding gums. If you have 1 to 3 millimeter of receding gums, again, it's normal. If it's above 3 millimeter, it indicates attachment loss. Now, this picture that you see right here shows a healthy gum tissue. Here, the socket is surrounding the bone, and as you can see here, the tissue fibers are attaching the tissue to the tooth. Now, once the disease is present, then we progress into a stage called gingivitis. This is the first stage of periodontal infection. Now we have, as you can see here, this is a healthy tissue. It's kind of pink and there's no affected areas. However, as you can see here, this is the diseased part. It's red, it's swelling, and sometimes there's also bleeding, and that is why it's called gingivitis, because we can also see some swelling over here. And the measurement tool will also go down deeper to a 4 millimeter depth, which is not normal and not recommended at all. Now, fortunately, gingivitis is reversible, and it's a type of periodontal infection basically that results because of plaque and tartar. Now, plaque develops, it's a bacteria when the bacteria attaches to your tooth, and eventually it turns out to be tartar when it dries up. Now, if the bacteria stays in the pocket, then we go to a stage called early periodontitis. Now, during the early periodontitis stage, as you can see here, all the tissues are affected and everything, just like gingivitis. However, the difference is we have bone loss and also the tissue fibers are damaged. That is why the tissue is flapping away from the tooth. The measuring tool will also go deeper to a 5 millimeter depth, and if we do not treat this, then we go to a stage called moderate periodontitis. Now, during the moderate periodontitis stage, everything is the same as the early periodontitis and everything, except the probing depth will also go deeper to a 5 millimeter depth. Now, if we do not treat the moderate periodontitis, then we go to a stage called advanced periodontitis. Now, during the advanced periodontitis stage, the measuring tool will go deeper to a 6 millimeter depth. As you can see here, the bacteria is also affecting the tooth really badly, which might result in you losing your teeth. And yeah, more bone loss, more fiber tissue disattachment, and everything. Now, it is one thing to note here is that it is your immune response that is causing this tissue destruction and this bone destruction, and not the bacteria itself. Your immune response trying to destroy the bacteria results in the tissue and the bone destruction. Now, looking at your Perio chart, I noticed that you have some really deep pockets localized to the posteriors. Your anteriors look okay, but your posteriors have 6 to 10 millimeter depths, which is really bad. It's irreversible. However, I also noticed that you have a moderate bleeding while I was probing, and there's also a recession on your lower anterior teeth and some of your lower posteriors as well, and also recession on your upper back teeth. And that's about it. Do you have any questions?
No.
Okay. And if you ever want to get it, the best way to get it treated is there are 2 methods, basically frequent dental visits, and one of the most frequent questions people have is, how do I get it treated, when we explain this to them. So the most important things are frequent dental visits and adequate self-care while you're at home. So frequent dental visits, I'll basically start removing plaque or tartar, and for the taking care of yourself at home, just brushing twice a day, rinsing, and flossing once a day as well. Thank you.